Hello, my name is Kate Taylor. I am filming this on July 28th, 2025. This is my presentation on cystic fibrosis. My presentation can be broken down into 4 segments, which I will be going through. We have a lot to get through information-wise, so let's get started on the basics. What is cystic fibrosis? Cystic fibrosis, or CF, is a genetic disease that primarily affects the lungs, reproductive, integumentary, and digestive system. It's a genetic mutation in the CFTR gene that causes the inheritance of CF. Normal function of the CFTR gene is responsible for making the protein CFTR, and this protein functions as a channel across cell membranes that produces sweat, saliva, mucus, tears, and digestive enzymes. In cystic fibrosis, it's a mutation that leads to a dysfunctional CFTR gene, which causes blockages and unchecked production of mucus and cellular membranes. In short, cystic fibrosis disrupts the body's ability to regulate the movement of salt and water in and out of cells. And kind of coming back to those 4 systems that I mentioned previously, it affects 4 main systems within the body. Within the lungs, the CFTR gene maintains a thin layer of fluid on the lungs, but because there's a faulty protein with CF, it leads to a thick, sticky mucus within the lungs, making it difficult to breathe, as well as creating a breeding ground for bacteria. Many people with CF develop frequent infections due to bacterial buildup and often on antibiotics and use preventative treatments for clearing the mucus. Reproductive-wise, males experience infertility and females experience menstrual irregularities and difficulty conceiving. This is due to the thickening of mucus and secretions caused by the CFTR mutation. Genetic counseling is recommended for those with CF who are considering pregnancy as well. In the integumentary system, it's the impact on the sweat glands. So people with CF are unable to reabsorb salt from sweat, leading to electrolyte imbalance and heat regulation problems. So the inability to reabsorb sweat can impair the body's ability to regulate body temperature. So heat stroke is really common for those with CF. There's also an increased risk of skin infections due to bacterial buildup because that sweat is being unable to be reabsorbed. So good hygiene is always recommended for those with CF. In the digestive tract, thick mucus obstructs the pancreas, which means proper fluids and electrolytes are not balanced within the intestines. Mucus blocks ducts that carry digestive enzymes in the pancreas, and there's a high likelihood of type 2 diabetes mellitus secondary to CF due to blockages in the pancreas and insulin not being able to pass through and regulate blood sugar. It affects the liver's ability to produce and secrete bile as well. Now into the cellular basis. CF is caused by a mutation in the CFTR gene, which provides instructions for creating the protein, cystic fibrosis transmembrane conductance regulator, or CFTR. Cellular impact of the production, processing function, and stability of the gene. There are 6 classes of this mutation. So there's 3 on this slide and then 3 on the next. Class 1, you'll kind of notice with each of these classes, there's a lot of similarities in all of them. But class 1 protein production mutation prevents the production of the CFTR protein. It's either the complete absence or significantly depleted CFTR protein in cell membranes. Occurs due to premature termination or mutations affecting mRNA processing within the CFTR gene. Class 2 protein processing mutations leads to misfolded CFTR proteins, and because cells recognize folded proteins, misfolded proteins then create imbalances and quality control mechanisms preventing proteins from reaching the cell membranes kind of kick in at this point because that protein is misfolded. So the protein doesn't reach the cell surface. Class 3 is gate mutation. Gate is also synonymous with channel. So if the CFTR protein does not reach the cell membrane, it has impaired function due to that misfolded protein. The gate or the channel refers to the flow of substances in and out of cells. And impaired regulated results in the gate being closed. So there's no way for things to get through in and out effectively and leads to a buildup of that thick, sticky mucus that I've discussed and other secretions within cells. Moving on to class 4, conduction mutations. CFTR protein reaches a cell surface, but due to the mutation in the channels or the gates, the structure is altered and hinders the flow of chloride and bicarbonate ions through the gate and channel. I'll discuss those 2 ions in the next slide as well. It causes mucus buildup within these channels, thus causing further cellular distress. Class 5, insufficient protein mutations. Mutation leads to a reduced quality and amount of the CFTR protein. Problems in reduced amount means that there's less of that protein reaching the cell surface and leads to a protein deficiency, and meaning that the cell will also regulate in other ways because there's no protein that's regulating, in other ways causing further cell damage. Class 5 is redacted stability mutation. Results in CFTR channels or gates having increased instability because there's not enough of the protein within those channels or gates. It causes increased cell turnover, which requires more of the already depleted CFTR gene. And because of that increased cell turnover, it's once again just depleting the active CFTR gene, thus creating more problems within the cell. In terms of cellular distress, the 6 classes listed previously can affect the cells in many different ways. Here are just some of them. Trapped chloride ions that cannot move in and out of the cells. Chloride ions maintain balance and acidity within the cells. Dehydrated cellular surfaces. Without chloride ions moving freely, cell surfaces become dehydrated, and then we go into the thick, sticky mucus. Dehydrated cell surfaces lead to a production of that thick mucus in organs like the lungs and the pancreas. The mucus can trap bacteria, clog airways, and cause issues with digestion. Impaired mucociliary clearance, specifically in the lungs, thick mucus impairs cilia to clear the airway of debris and pathogens, leads to further cell and lung infection because there's no way for that mucus to get out of the lungs, so it just keeps it trapped within. Dysregulated bicarbonate transport and pH balance. CFTR helps with transport of bicarbonate ions and manages the pH of cellular surface liquid. The mutation leads to an acidic environment for the cells, which then hinders immunity response and mucus clearance. So it's this really vicious cycle that keeps happening. Bicarbonate ions also assist with maintaining acidity within the cells. So bicarbonate and chloride ions are really important for that movement in and out of ions and maintaining homeostasis. There's also an impact on lipid metabolism and immune response. Lipid metabolism and function of immune cells such as macrophages and neutrophils. This creates an increased inflammatory response and impaired immune response as well. Here are kind of the more metabolic pathways that can be affected with CF. There's I kind of broke it down into 2 enzymes in metabolism. Pancreatic enzymes, the thickened pancreatic secretions block ducts that carry digestive enzymes to the small intestines, causes problems in digesting fats, carbohydrates, and proteins. Also within the pancreas, those gates and channels are blocked, so insulin production is hindered as well. So type 2 diabetes is prevalent. And intestinal enzymes prevent stomach acid from being neutralized. Again, those bicarbonate ions help with the pH, and because they're not able to move in and out of cells, there's nothing managing that acidity. So intestinal tract, it's really acidic, and it's not neutralized within the small intestine, which further impacts pancreatic enzymes from being developed. In terms of metabolism, glucose metabolism, as I kind of discussed, diabetes mellitus secondary to CF. Lipid metabolism, abnormal levels of unsaturated fatty acids causing that inflammation or that inflammatory response. Glutathione metabolism, it's a key antioxidant, so oxidative stress can be really high in this. And steroid hormone metabolism, so metabolism of cortisol is usually low as well. More on the genetic side of things. Here are the kind of key genetic points for genetic ontology. Inheritance follows an autosomal recessive pattern, so the person needs to inherit 2 copies of the mutated CFTR gene from each parent. If only one parent has this mutation, then the offspring would be a carrier for the mutation but would not show symptoms of CF. CFTR gene provides instructions for the protein, which acts as a gate or channel within cell membranes. There are a lot of mutations that can happen with the CFTR gene, so there's over 1,700 different mutations. And that I'm going to kind of jump down to severity. It can depend on mutations present as well as other genetic and environmental factors. So because there's so many different mutations, depending on how many an individual have, that can impact the severity. Individuals with only 1 copy of this mutation will not show symptoms. So again, it's that 2 copy sort of deal that would be required to show inheritance. Environmental, lifestyle, and epigenetics. This is possible additional effects. This isn't a root cause of CF by any means. These are just kind of things that can exacerbate or worsen symptoms. CF is a genetic problem. It's not an environment or a lifestyle problem. In terms of worsening the environment, air pollutants such as proximity to traffic or rural areas have a higher risk of developing certain airborne pathogens. Warmer, more humid climates and temperatures can be optimal for those with CF due to the lower respiratory pathogens. So a lot of people with CF will live on the coast where there's that high humidity, right? Lifestyle nutrition plays a large role in ensuring that the correct nutrients are being absorbed because there is that thick mucus blocking a lot of things. Hydration is important for those with CF due to dehydration within the cells and issues regulating heat. And again, many people develop diabetes type 2 due to deficiencies and nutritional concerns. In terms of epigenetics, it's still pretty poorly understood, and there are many factors that contribute to the development of CF. So it's not an epigenetic condition by any means. The epigenetics of it kind of involves adding different chemical groups to DNA. So one is a checkyl group that can silence gene expression, and the other is an acetyl group, which can make DNA accessible for transcription, potentially decreasing CFTR expression. Moving on to treatment. There's many options prior to pregnancy and after the birth of the child for diagnosis. All newborns are screened for CF. That's kind of one of those non-negotiable things nowadays. And genetic testing is always recommended prior to pregnancy for CF, as well as other genetic disorders. So it's recommended so that way we're more prepared for the birth of the child. When the child is born, should none of this have done before in terms of the genetic testing and knowing if that child would have had it been born. Increased of immunoreactive tricinogen or IRT in blood tests can indicate CF. If there's high levels of IRT, then they will do a sweat chloride test, and if that comes back positive, then it indicates a positive or a negative CF diagnosis. There is no cure for cystic fibrosis. Unfortunately, there's a genetic mutation, and we're not quite in science at the place where we can stop genetic mutations at the time. There are many treatments to lessen symptoms and improve the quality of life. So current treatments focuses on improving quality of life and the symptoms of CF, not the reversal of the cure of the mutation itself. Medications-wise, antibiotics due to increased infections, mucus thinning medications due to that buildup in the lungs and the pancreas as well as small intestine, bronchodilators, NSAIDs due to that inflammatory response, pancreatic enzyme capsules to help with the production of insulin in and out of the pancreas for blood sugar control, and nutritional supplements as well. In terms of therapies, you have airway clearance therapies. It's mainly the therapies are for the lungs. Manual chest therapy, which kind of hits your chest a lot, and then it makes you cough things up, as well as special breathing and coughing techniques and those PAP devices, which is kind of what I talked about, where you'll breathe in warm, humid air, and then it'll cause you to cough a lot. Lifestyle, exercise is important. Good hygiene, vaccinations, and a balanced diet is highly recommended for those with CF. In terms of research is focused on multiple ways for CF. Research aims to improve treatments, find a cure, and improve the life of those currently living with CF. The current clinical trials is genetic therapies, treatments for infections, and improving modular therapies as well. The genetic therapies is gene therapy, gene editing, and stem cell research. Infection treatment is managing infections, early detection, and vaccine research. And then the CFTR modulators, Trikafta, Kalydeco, or Orkambi, or Symdeko are some CFTR modulators that have shown really good research. They're still in their early clinical trials, so it's not widely available, but there's been good data on these medications, especially Trikafta. My cousin has CF and she's on Trikafta and has noticed amazing results. My boyfriend has a cousin who also has Trikafta, or taking Trikafta for CF, and also amazing results. So again, it's just lessening symptoms and improving outcomes, not necessarily a cure, but the research is showing that things are working with more research. Here are my sources from CF. I hope you enjoyed my presentation. I enjoyed researching it and learning a little bit more, especially because it really impacts my own family as well as my boyfriend's family. So learning more about this and the metabolic pathways and the enzymes was really enjoyable for me to learn. And thank you so much for watching. Have a good day.